anything and everything.
Do you ever wonder how to? Do you ever wonder why?
About anything and everything. Then Doris is your guide. Anything and everything will open your mind. Anything and everything with Doris. Anything and everything with Doris is online. Remember. Anything and everything with Doris.
You are listening to Anything and Everything with Doris podcast. This episode is brought to you by WYSK Spark Radio, the spark of the South. Listen to hits from the 70s to now. Find it on Live 365 Spark Radio. Hello, everyone. I hope you've had a great week. I hope you're feeling blessed, especially if you haven't caught the virus yet. Not to panic. Last week, we did touch on where they believe it started, Wuhan, how it mutated from bats, and how we can protect ourselves, just like we protect ourselves from other viruses. And then we did a small comparison between MERS and SARS. This week, I've had 2 other articles pop up that I thought might be interesting. The first one is called the Coronavirus Superspreader. Now, I want you to keep in mind that this can happen with any virus. This isn't the first virus that this has ever happened to. We see this even with the flu. So the title of a super spreader is someone who can spread the disease to a disproportionately large number of people. For SARS, a person had to infect at least 8 people to qualify for the title. And for MERS, it was 6. Doctors also do not know for certain why some people infect more than others and believe that a mixture of environmental and biological factors are at play. And Dr. Sylvie Bryant, Director of Pandemic and Epidemic Diseases at the World Health Organization, says she's concerned that individuals labeled as super spreaders could be stigmatized. Of course, we all agree with that. We've seen that before in other illnesses. So here's how they're comparing a regular carrier of infection to a super spreader of infection. The regular carrier gets infected, infects others within close proximity of about 2.6 people. Then the infection is identified and the carrier goes into quarantine and gets treatment. Now, the super spreader of infection gets infected, infects others within close proximity, which would be about 6 to 8 people, and then they travel to a new location with the infection undetected, and the carrier continues to infect more people. And then it becomes identified, the carrier goes into quarantine and gets treatment. They're saying most people will only infect 2.6 people before they realize they have it, whereas your super spreader is going to infect 6 to 8 people and then travel and infect more before they even know they have it. Now, yes, this happens in other viruses. This is not new. But because worldwide 40,000 people have already been infected, of course, this is cause for concern. And then they list a profile of the 10 most likely culprits, which we probably already know. If you think about it, it all makes sense. But I'll go over them very briefly. You have the international traveler. And their example for that was in 2003 during the worldwide spread of SARS. A doctor who treated the first patients in his home province of Guangdong, China, where the disease first emerged, unwittingly picked up the disease before traveling to Hong Kong. There he stayed at a hotel packed with international travelers and spread the disease to 15 other hotel guests, who then took the virus back to their home countries, which included Canada, Vietnam, Singapore, and Taiwan. And then a British man was involved in a super spreading event that had occurred at an international conference in Singapore, where several other people also contracted the disease. One conference attendee has tested positive for the virus in Malaysia, as well as 2 in South Korea. So you see how international travel obviously is one culprit. Then you have the coughing commuter. They found that those that live furthest from a city, like say central London, will spend longer on the underground, potentially coming into contact with more infected people. And especially if they have to get off the tube at a busy interchange. Now in the United States, we have subways and buses, and people live in suburbs and go to the cities. So anytime you have longer commutes and you're around a lot more people, that makes sense that you're more likely to get any kind of infection. And then you have the air steward. Flights are notorious for infection potential, but not for the reason that you think. They said in a study published 2 years ago, researchers at Emory University worked out that the person most likely to spread disease on a flight was a member of cabin crew rather than a passenger. Which that does make sense, right? They're in contact with all these passengers. They could pick it up or they could have gotten it from wherever they live. And now they're around all these passengers. So that makes sense too. Then you have the social butterfly, the person who likes to go from party to party, kissing, shaking hands, sharing drinks, whatever they do. So that's obvious. Then you have the constant cruiser. Now I love cruises, don't you? Like that's my favorite way to travel is by cruise. I don't care to fly. So cruises are number one for me. And I'll tell you, it's been kind of nerve-wracking when I look at the people on the cruises and they get locked into those rooms. Only one time did I go on a cruise when I took the small room, right? You had no windows, interior room, very tiny. And I was like, I'll never do that again. Then after I saw that these people were quarantined to their rooms, I remembered the room just recently that we won last year. We had a balcony. It was a suite. You know, we had a sofa. We had the bed. We had a large bathroom. We had a balcony. It was like, well, I wouldn't mind being quarantined in a room like that. Then you have the hospitalized patient. Well, that makes sense. Hospitals are known for people going in there sick and catching something else and getting sicker. Not to mention you have the doctors and the nurses that are around that all the time. They could be spreading that. Then you have the lazy cleaner. A recent study in the Journal of Hospital Infection has shown that MERS and SARS coronaviruses can last on inanimate surfaces such as glass, metal, or plastic for an average of 4 to 5 days, but in some cases for up to 9. So low air temp and high humidity can also increase their lifespan. But the good news is that these bugs can easily be killed with good old-fashioned bleach. Then you have the hair flicker. Experts warn that the perfect way to pick up the disease is to touch a contaminated surface and then touch it to your face or touch your mouth, nose, and eyes. An observational study of students found that they touched their face an average of an astonishing 23 times per hour. You have the seemingly healthy patient. Now, it's unclear whether patients with the coronavirus can transmit the disease if they are not yet displaying symptoms. This is a key question for those trying to control the outbreak. A Chinese woman visiting colleagues in Germany was said to have infected several people without appearing ill. However, these reports were later called into question. And while it is still unclear whether the British superspreader was displaying symptoms or not, he was well enough to go skiing and to visit a pub on his return home to Brighton. Then you have the affectionate child. Now you think the coronavirus seems to mainly affect older people, but some children have picked it up, including a 9-year-old British boy. And I don't understand why that would surprise people. that children wouldn't pick that up. Look at all the crazy things children pick up and bring home to us. Children are perfectly placed to spread disease as they spend a lot of time in close contact with each other at school and the nursery. A school in Southampton sent pupils home after one student who had visited Southeast Asia recently started to display symptoms. And schools with Chinese students are being told that they should encourage their pupils to stay in the UK for next week's half-term holiday. Now, I found something interesting in the story. Chinese doctors have reportedly been using the HIV drug lopinavir, ritonavir, as an off-label treatment for people with the 2019 coronavirus. So clearly there's no denying at least some link between these two viruses. Meanwhile, other scientists seem to be wasting no time to continue tinkering with viruses and trying to capitalize on the outbreak. In an article published on February 7th, Robin Shatlock, head of mucosal infection and immunity at Imperial College London, stated bluntly, "What's important is that as a global community, we maximize our effort to get a vaccine available in the shortest possible time. Big pharma experts are hopeful that a vaccine will be available as soon as 2021, faster than it's been done before." There we go. Getting another vaccine. Don't forget, this week I put out some recipes for elderberry and for an all-natural hand sanitizer. I got like 3 recipes on the blog for that. So just check out my blog. They're really good recipes and they're very helpful. Now, remember in the last episode when I was talking about the coronavirus, I was letting you know that the reason I waited was because new information is always coming out. And so I never come out right away, right when the virus first hits, because you're going to get some wrong information. So that's why I wanted to give you the updates that I just previously gave you today. But on February 10th, a very interesting article came to my desk that I also would like to give you. It's something to think about, and I don't want you to be shocked because this has happened before. Now, this story is by a bioweapons expert, and just wait till you hear what he has to say about the coronavirus. There's so much more to the 2019 novel coronavirus than mainstream media would have you believe. We only need to start with the virus's origin story to start pulling back the layers of deception and misinformation. The prevalent theory has been that the coronavirus began in a wet market in the central Chinese city of Wuhan. Now, blistering new revelations from an American bioweapons expert shatter this theory and point to a much more sinister beginning for the virus, which has amassed a current death toll of over 800 people. And that last count was February 10th. There's a U.S. international law professor who's claiming the deadly virus was created in a Wuhan laboratory, a laboratory specially designated by the World Health Organization. Dr. Francis Boyle is a professor of international law at the University of Illinois College of Law. He holds multiple prestigious degrees, including a Doctor of Law degree from Harvard Law School and a PhD in political science from Harvard University. He's best known for drafting the Biological Weapons Anti-Terrorism Act of 1989. In a recent interview published on January 30th to YouTube, Dr. Boyle gave a detailed account of how the 2019 novel coronavirus did not originate in the wet market of the Hubei province. Was the virus ever actually present in the market? And could its presence have accelerated the rapid viral outbreak? Absolutely, Dr. Boyle and others would argue. But that doesn't mean the virus actually began there. So where did this dangerous strain of coronavirus begin? Dr. Boyle contends that the virus was manufactured and bioengineered in a biosafety level 4 laboratory, a laboratory that just so happens to be located directly in Wuhan. This laboratory is specially designated by the World Health Organization as the only lab in China that can contain and work with the world's deadliest viruses. Dr. Boyle asserts this is proof that the World Health Organization knows far more about the outbreak than they are letting on. The allegation is consistent with a January 2020 paper published by The Lancet, which found that more than a third of the patients tested in their sample had no contact with the Wuhan wet market, including patient 0. In other words, growing evidence suggests that the 2019 novel coronavirus leaked out of the Wuhan laboratory and into the surrounding community, where it would go on to infect thousands of unsuspecting people, a number that's steadily rising. Now scrambling to contain the epidemic, the Chinese government initially tried to cover it up. They even threatened and attempted to silence a Chinese doctor named Li Wenling, who first warned of the coming outbreak. Sadly, breaking reports tell us that Wenling succumbed to the virus on February 7th. It also says new coronavirus has links to manufactured SARS virus and HIV virus. Now remember, we just read that they were using some HIV medications for it. Why would they do that? Why manufacture and design a lethal and unprecedented virus? Simple. Dr. Boyle asserts, to create biological weapons for warfare. In the interview, which hopefully won't be removed from YouTube, he hypothesizes that the World Health Organization affiliated Wuhan scientists genetically tinkered with the coronavirus responsible for SARS until it became the monstrosity it is now. The current coronavirus reportedly has a 15% greater fatality rate and 83% greater infection rate than SARS did, which ransacked the world in 2002 to 2004. Dr. Boyle also cites evidence indicating that Chinese officials smuggled coronavirus materials out of a Canadian lab that's known for leading research, development, and testing of biological warfare weapons. Additionally, a team of Indian virologists just revealed in a January 2020 paper that the 2019 novel coronavirus shares an uncanny similarity of genetic inserts with the virus that causes AIDS. Their paper has been withdrawn. Another thinly veiled cover-up attempt, he suggests. So today we learned a lot more about the coronavirus than we knew last time. We learned about the super spreaders, the difference between a regular carrier of infection versus a super spreader of infection. We learned the profile of the 10 most likely culprits of spreading or getting the virus. And we learned from Dr. Francis Boyle, a bioweapons expert, and how he believes it was actually created in a lab for biological warfare and how it leaked out. Don't look at it as, oh, it's just a conspiracy theory, because we know this happened before. And if this is a regular virus, why are they using HIV medications for it? Think about that one. There's definitely things that we have not been told. And if the light bulb didn't go off in your head last week when they showed on the news, they actually tackled someone in China and arrested them for not wearing a mask. In China right now, if you do not wear a mask, whether you are sick or not, and you're in public and you do not wear a mask, you can go to jail. Right there, my friends and I saw that and we were like, wait a minute, something's not right here. And think about it, 40,000 people worldwide have been infected, and that last count on the 10th, it was 800 deaths. I'm still not going to tell you to panic. I'm still going to tell you to just be cautious. Even though we know it's worse than the flu, treat it just like any other epidemic. All the cleanliness, all the little tips that we talked about last week that you would do for any other virus, keep doing it. But what I'm going to tell you is the most important thing you can do in order to defeat any virus is going to be working on your immune system. Push the vitamin C. If you have elderberry, take elderberry also. But if you don't, chug-lug that vitamin C. And you can get your vitamin C in juice, in foods, and supplements. But don't do the supplements long term. Because as we know, you're at more risk getting kidney stones the longer that you take a vitamin C supplement. So eat the food, drink the juices, do whatever you have to do to boost that immunity system of yours, and you'll be able to fight this a lot better. And of course, as anything new comes up about the coronavirus, I will have another episode up here updating you. So thank you for listening, and God bless. And that's our show. Thanks for listening. And until we meet again, enjoy every day to its fullest. God bless. For comments or questions, you can reach us by email at yopi@post.com. Also, check us out on Twitter at Dorisi and our Facebook pages at Yopi Studio or Louisiana Entertainment Association. Anything and Everything with Doris is produced by Your Own Production Incorporated and comes out every week. So come on back. Feel free to add us to your favorite RSS feed and iTunes, iHeart, Spotify, Stitcher, Google Pod, and our favorite, Podbean. All links are found in our show notes below.